If you want to define Anuloma, please refer the Sroto Vikaranam 15th chapter by commentary. I am not very well versed in reciting shloka and making Anuvada. Please go to the Hindu commentary on this particular shloka. So I will just give you a criteria. What he has told, I just translated into English. The first criteria is observe the normal gati of the Vakdosha and karma of Vakdosha. That is for physiological function. Then movement of Vata in its own srotas, movement of Vata in its own direction, monitor the functions of that particular Vata which it is doing, then monitor the functions of the regulated organs by that particular Vata. Pranavaka Murtara, Puraha, Kantacharo, Buddhi, Hridaya, Indriya, Chitta, Sthivada, Kshavata, Udkara, Vishwasa, Anna Praveshana. Right? So for Pranavata, if you consider making Pranavata Anuloma, apply this particular into Pranavata Anuloma. If hypertension is because of Pranavata Dushti, apply Pranavata Anuloma. Anuloma is not always downward movement. For all Panchavatas, Anuloma is different because all Panchavayus have a different direction of flow. Udanam, Yoje, Purto. That is the Anuloma Gati of Udanavayu. Pranavata moves from Shiras to Ura Pradesha. That is the Gati of Pranavayu. So Anuloma of Pranavayu means making Pranavayu to move in its own srotas first. Second, it has to move in its own direction in a downward movement. Then monitor the functions of Pranavayu. What are the functions of Pranavayu? Sthivanam, Kshavatu, Udgara, Nishwasa, Anna Praveshana. Monitor 5 functions. After giving Pranavata Anuloma Chikitsa, if all these 5 functions are correct, your treatment is correct. So that is the assessment criteria. What are the organs which are regulated by Pranavayu? What are the organs which are regulated by Pranavayu? Prano, Murtara. So it regulates all the indriyas. So assess the functions of indriyas first. Next one is, what is the next function? Buddhi, Hridaya, Indriya, Chitta. So all these organs are regulated by Pranavayu. Assess the functions of Pranavayu. Then if you have prescribed any line of treatment for Pranavata Dushti, you can assess the effect of treatment. My prescriptions, you can just go through it. I'm not detailing all these things. So Arakvadadika Shaya, Pathyapanamavadika Shaya, Brahatyadika Shaya, if kidneys are involved, if Pathyapanamavadika Shaya, if there is an involvement of Shotas, congestive cardiac failure, if Arakvadadika Shaya, if it is an involvement of the Adisantar Pranavata Pramehajanya hypertension or dyslipidemia leading to hypertension. So we can go with the Arakvadadika Shaya. So cause is different, dosha is different, dosha samuchaya is different, sthan samuchaya is different, the drug of choice is different. So further, Kaidaviyadika Shayam, CKD is hypertension or dyslipidemia. Similarly, Hamsapathyaadika Shayam, hypertension because of hypothyroidism. So like that, you can make a permutation combination of drugs in specific to origin, Udbhavasthana of hypertension. Kapamena Savartavata. If it is Kapamena Savartavata leading to hypertension, go with Varnadi, Guru, Vikaranam Chikitsa tatha, Medo-Pranavaha Sroto Vikaranam or Kaishwara Guru may be made into different Anupana Bhedena Prayoga. So Rakta dosha is involved, or Rakta dhatu is involved. You can go with the Mahadikta Kashayam or Manchistadika Kashayam, making Anupana for the Kaishwara Guru, or Panchadikta Kashayam in Pitta and Kapahana, Pajanam, Shodhanam and Visha. Patoladika Kashayam, Tiktakam, and one of the important is Vishakam. One more disease under the context of Medo-Pranavaha Sroto is polycystic ovarian disease. So this is the polycystic ovarian syndrome, this is the polycystic ovarian disease. So to differentiate between these two clinical conditions. What are the prescription you can go with? You can go with the Pachana, with Amrutottam. Then if you want Sroto Shodhana Chikitsa, you can go with selection of the Amashayatavada Chikitsa from Sushita Chikitsa Sthana Vatavayadhyaya, Amashayatavada, or Pushta from Ashtanga Chikitsa Sthana. Then Shavana Snehavada, you can select the Dadimadikata. Anuloma, you can make Anuloma of the doshas with Abhyarishta or. So when to give Anuloma in a polycystic ovarian? When menstrual cycles are irregular. When to give prescription for Anuloma? When to prescribe Rajat Pravaktinivati? When not to prescribe? When to prescribe Rajat Pravaktinivati? What is the indication of Rajat Pravaktinivati? Rajat Pravakti. It helps about the menstruation. And when to give? Months together, years together. We have seen so many prescriptions, months together. So Rajat Pravartana happens when? First week, second week, third week or fourth week? Prescribe Rajat Pravartana after third week completion. Don't prescribe before that. You don't want to start Pravartana after Rajas, no? So Rajas should be made Pravartana after third week itself. It should not be prescribed before that. So first week you have to go for Rasa Shuddhi. Second week you have to go for Artha, nourishment of the Artha, pregnant of the Artha. Because egg is getting released, dominant follicle is required mid of the cycle, 14th, 15th or 13th day. So you need to give more Brahman Chikitsa, that is, go for one Snehapana. Dharimadikata, Pradakata, whatever Snehapana you give it in the mid of the week, second and third week. So in the fourth week you go for Anulomana of the Rajas, Purana Rajas. Navina Rajas is getting accumulated in the first week, Purana Rajas is getting eliminated out in the last week. So don't give Raja Pravartana with Purana, Navina Rajas is getting accumulated. When you need nourishment, you are giving Anulomana. Then what is the use of it? So whatever prescription we give, it should have some sound rationality. That is what our acharyas are teaching. That is what our Samhitas gives you the insights. So prevention is always tougher than cure. Because you don't have any aim or goal. If you know something, you can prevent. Patient comes to you opening with a running nose, you can prescribe. Right? Future coming disease, how you are going to prevent? It becomes very difficult because I don't know which disease the person is going to suffer. Right? Without taking much of your time, everybody is hunger. First case, 52-year female, a teacher, having short in face, arms and legs, non-pitting type of edema. Vastapada Shitanagata, Shramashwasa, Klama, Udvega, and there will be a mood swing since 1 year. What is the diagnosis? What could be the diagnosis? What might be the diagnosis? Vitals, comorbidities, obesity, and dyslipidemia. What is the weight? 89, BMI is +2, +3. Right. So for every disease, we have got two types of hetus: Utpadaka hetu and Venchaka hetu. Utpadaka hetu, dosha prakopa. Venchaka hetu, recurrent manifestation of the disease. Allergic rhinitis, allergic bronchitis, or urticarial rashes. Utpadaka hetu along with Venchaka hetus are also there. So in this particular patient, Ruksha Shila Guru Ati, Ahara Sevana, Vishamashana, Vyayama, and Ati Asana are the Utpadaka hetu. What are the Venchaka hetu in this patient? Seasonal changes in the early morning, during traveling, during Dati Sevana, Masha Sevana, Taila, and psychological factors like Bhaya and Chinta. So these two etiological factors gives you the underlying dosha. What is the underlying dosha? Prana Prakopaka, Prana Dushtikara, and Samana Dushtikara etiological factors. So this was the investigation. What is the NTTPO? It was 272. NTTPO means? What is the TSH? It is 58. TSH is 58. What could be the diagnosis? In diagnosis, what is the diagnosis? Patient is more, BMI is more than 36. So, Staulia, Kapavela Savanta water, patient has also got dyslipidemia. Then, patient has got NTTPO, Ama Vishaya Shotha, that is Hashimoto's thyroiditis. So, what is the approach? What is your approach? How to initiate the treatment? Only Shotha Chikitsa is sufficient? Only Medo-Pranavaha Chikitsa is sufficient? What is the hetu? Hetu Viparita Chikitsa in this particular condition. You have to initiate 3 ways, no? Hetu Viparita, Dosha Viparita, Vyadi Viparita. What is the Hetu Viparita Chikitsa here? Amavisha is there, no? The cause for the Vyadi is Amavisha. So Hetu Viparita is Vishashamana, Vishagnam. What is the best line of treatment for Vishagnam? What is the Chikitsa Siddhanta for Vishagnam? Vishagna Chikitsa. Brahmana, Momana, Virechana, Langana. Yes. Langana is yes. Sroto Vikaranam is no. So first line of treatment is Langana. Langana से क्या होता है? अभी आपको हो गया ना? हम जो क्लास ले रहे हैं और आपका अग्निवृत्ति हो रही है, दिमाग नहीं चल रहा है, हाइपोग्लिसेमिया हो रहा है ना? अपदर्पण हो रहा है आपके अंदर. So Langana is the first line of treatment and Visha is Vikaranam Chikitsa. So the line of treatment given with the prescription of Purnamadi, Chetrakadi, and Pratikarya Chodas. You can see the result. So it has reduced from 58 to 9.89. No response for the anti-TPO much. It was reduced from 1. You can see the result of the anti-TPO. You can see the result in the next one. TSH has reduced from 58 to 5.67. Male patient, infertility case, no issues, obesity, testicular scan and hormones are normal. Hetu, identification of the Hetu, Prana, Samana and Pranavayu, Rasadushti, Medo-Dushti and Shukra-Dushti. You can see the report of the semen analysis, azoospermia. What type of azoospermia it is? It is a non-obstructive variety of azoospermia. So it is a Nastaritus. So Nastaritus, Rasadushti, Kapameda Savartamata, Prana and Samana Vayu is very involved. Aprinanam Bija Utpatti. So Aprinan is there and Bija Utpatti. Mela Sanchaya is there, Rasakshaya is there, and further next dhatus are not getting nourished. So there is a Bija Utpatti. So line of treatment followed with Advidipana, followed by Medo-Pranavaha Chikitsa and Vikaranam. I just show you the last one. So after Shodhanadi Karma, the state of treatment would be Shaman Sneha format. Best Sneha format in this particular condition is Dadi Maligata. Why I prescribe Dadi Maligata? Because one of the best Santanakara or Pula, which gives the Pula. So, Mokshu, Shruti, Ashwata, Kavigachu, this yoga is from the Chakrarata. You can see the result. So, normal azoospermia. From 0 to, he has traveled to 76 million. What is the clinical outcome? He has not delivered his wife certificate. Atipainchilya. If Shukra has got increased viscosity, that condition is called as Atipainchilya. So what is the treatment for Atipainchilya? Atipichila, Vaishatyakara. So Pichila opposite is Vishadikaranam. So Vaishatyakara Chikitsa, Rukshana, and you can go with the Lekhana Basti. Or one simplest is Dashamula Kashaya Basti. This could be the outcome of Atipainchilya Chikitsa. Clinical outcome. What is the carry-on point here? So comprehend the rationality, the intentions of our acharyas and samhitas. Know your limitation is very, very crucial and important. And learn, relearn. Once you learn, observe the same thing. There is DOEP session. Update yourself. Practice. Once you start practicing, preach and inspire others also, so that many people can also practice as well.
before we move on to the Pranavaha Sroto Vikaranam, any queries regarding this particular presentation? Any queries? See, we all know that Enne Hasti, Tadanyatra, Enne Hasti, Nadarpacha. Right? Right? Whatever the presenter has given the information, it's all there in our Samhitas. The perspective of analysis differs from person to person. Right? That is why the Acharya Charaka has given Jaragada Pariksha. Abdopadesha Jnana first, Pratyaksha Jnana next, Anumana next, and the last fourth one is very, very important to be a Chandura clinician like Dr. Pramod Ji. Yukti. How you utilize your Yukti in understanding whatever the Shastra Jnana you have gained in your classes, how you are going to incorporate that in your clinics, how the results are coming out. That is what is the gist of this particular presentation. If there are no queries, I request Dr. Pramodji to move ahead with the Pranavaha Sroto Vikaranam.
Namaste, sir. I have two queries. Patient of hypertension and diabetic mellitus is taking anti-hypertensive drugs or anti-diabetic drugs for more than 20 years or 30 years. Would you advise to withdraw the medicines and treat with Ayurveda only, or it could be combination of contemporary sciences? What is your take on this, sir?
It's a very practical question. Directly we cannot withdraw the drugs. From Patya to Apatya, Apatya to Patya. A patient who is consuming multiple drugs and withdrawing the drugs, the rules has to be followed. Padena Padena. So, you give your treatment of principle, advise the patient in a comprehensive mode, from Patya Kalpana, Vyayama, along with Aushadha. Of Ayurveda, you have to adopt. Step by step, you reduce the number of drugs. So, in such clinical condition, it is very difficult to stop the drugs. Chronicity is 20 years. Patient has got dependence on the drugs. So, if you withdraw, the patient may come out with some of the complications. So, better to maintain the quality of life. The best option would be try to minimize the number of chemical drugs. That is the first objective. So, once you advise the patient perfect modification of the diet and lifestyle, definitely many of the drugs can be withdrawn. Try to identify from where the disease has started. Which are the Mula doshas? Prathama dosha drishti. So identify first dosha which has initiated the manifestation of the malady. That will help you to focus your line of treatment. Similarly, you have to also focus on the present complications what patient is suffering from. Multi-organs, multi-systems, if they are involved, it becomes difficult to withdraw all the drugs. But you can definitely reduce the number of drugs. And you can transfer patient to Anupatrava Avastha. That is the objective of a clinician. If I stop all the drugs at a stretch, it becomes very difficult to manage the complication. So step by step, as you get the confidence and all the parameters comes to normal, slow and steadily you can reduce the number of drugs, and sometimes at one juncture it will come that you can stop entire allopathic drugs. At least antihypertensive, at least diabetes, at least multiple drugs which are being prescribed along with antihypertensive and anti-diabetic drugs. So that is the objective what I practice.
What we can do in juvenile diabetes? How can we treat the patient is juvenile diabetes? Is it an insulin dependent diabetes?
More than 95% of beta cells have degenerated. Insulin is the only answer for that. Objectives are many. Quality of life, reducing the dose of insulin, improving the immunity of a person because in Prameha, Oja Dustri will become, Oja Rapat will be more, complications are more. Fluctuating glycemic index can be brought into stable so that the complication can be reduced. You have treated patients, very few have responded. It's not possible because more than 90-95% of practice has been degenerated. So the patient is on insulin dependent. From my perspective, I don't have much experience in reversing the type of juvenile diabetes.
Thank you, sir.
One more take home message from this particular statement. Always know your limitations. Always in your clinics, know your limitations. Better what to be done is given much importance than what should not be done. At your clinics, if you want to be a successful clinician, this should be practiced always. Know your limitations.
Namaste, sir. My question is regarding diabetes. In type 2 diabetes, there is nowadays it is more of stress-induced diabetes. And we are also working on stress-induced diabetes as well. So, can you give a brief about it? What is the stress-induced diabetes and how we manage it?
So, to start with, everybody's body types are different from each other. Again, as Sir told earlier, the same thing is trying to understand what the person can stop from tomorrow, what the person can leave from tomorrow. If it is the root of the stress should be understood. For example, if the person is suffering with any of the type of the stress, first counseling is one of the important way of understanding the stress related disorders. First counseling, so that try to understand what is the reason for the stress. Followed by there are several types of things happening in the market now as well as in yoga also. So dhyana, and samadhi are the fifth, sixth, and seventh, eighth steps of yoga, Ashtanga yoga. Dharana is when the person is not controlling something, continuously he is losing his temper, continuously he is losing his concentration, means try to bring back and do dharana of that particular thing. Once the person gets mastery over the dharana process, proceed to dhyana, where the concentration will be able to go with, the person start concentrating on that, so that the cause, type and system is to be corrected, followed by the Kapalabhati is one of the very important things because the frontal brain is ignited, stimulated, so that all of the spine is involved. That's why you have results, especially with the dharana, dhyana, samadhi, and Kapalabhati in this. Exercise is one of the important again practice because you need to burst out that stress, going away, that is going for those travels. Give yourself time is also one of the important thing in this to come out of the stress. This can be avoided.
So can you modify the samadhi whenever you are taking? So nowadays samadhi is they actually don't know how to follow it in a simpler way or easier way. How we convince our patients to follow the samadhi?
Samadhi is the last step of Ashtanga yoga. Without following yama and niyama, where the social and the personal hygiene or personal ethics are not followed, you cannot go to the next stages of Ashtanga yoga. It may be yama, you should practice yama, get mastery over yama, then proceed to niyama, then asana pranayama. Once you have mastered over the dharana stages, after the completion of pratyahara, which is one of the important and the difficult most to practice of Ashtanga yoga, where the body which has gained a very good strength because of the practice of asana and pranayama, the person has to shift the gaze to the mental modifications, mental conflicts and all. So dharana, dhyana and samadhi is the last step. Once you have mastered the dharana and dhyana, automatically the person will shift to samadhi. There is no doubt in that. So it is all about mastering the previous steps.
So how do you simplify the samadhi of, as you mentioned, we have to follow the samadhi. How do you simplify and follow so we can tell to our patients?
It is vairagya. Actually speaking, it is vairagya. whatever the things which are not making you to do what you want to, that is to be diverted, that is to be destroyed, or that is to you come out of that particular situation or the time of that particular moment, then only the samadhi can be achieved. Otherwise, it is
I mean to say detachment, sir.
yes, complete detachment.
Thank you, sir. Sir, my question to Pramod sir, sir, can you throw light on
Just to add on, sorry to simplifying the samadhi in day-to-day practice is just like ask your patient to be a follower of Charvaka. To be a follower of Charvaka. Right? Have you got the answer?
yes,
What do I mean?
detachment, sir,
Just believe Pratyaksha.
yes, sir.
That's it.
Yes,
Right? No continuous,
yes, sir.
nothing.
Yes.
Easy going. Charvaka. Right? Continue.
Sir, in the stress-reduced practice, how we do the Sambhasha and how we follow the case as it is stress-reduced practice. So, can you throw light on it?
Stress is also one of the basic cause for the prameha. Directly acts on the brain, and all the hormones related to the brain are actively involved. And there is a direct link from the brain to the gut. Right? So, nervous system, the mind, and the entire endocrine body is directly linked with the stress. So, the first and foremost line of treatment what you need to follow is Pranavaha Chikitsa.
So, those should be considered
Three Chikitsas are there, whatever I told earlier. Hetu, you have to identify the Hetu for the thing is, Manasa is positive factors of the manas. And what these nidanas are producing, affecting on the dosha. So, the psychological factors are more involved, stress is more, ask the patient to go for physical activity. If more physically stressed, then ask the patient to go for the mental activity. So, shifting and balancing the doshas are first and foremost. If these manasa doshas are also responsible for the formation of mana, according to Sushruta, Atichinda, right? Gurdum, Abhyavahara, so Jipala, so many intellectual factors under the context of manas have been attributed for the Sankalpa of Jnana, producing sama doshas. So identify the Hetu Viparita Chikitsa you have to initiate. Then it comes with the dosha Viparita Chikitsa. In that dosha Viparita Chikitsa, Pranavaha is the basic cause for that. And Pranavaha is taking sthana samshaya in the shiras. So Pranavaha the Mula sthana in the shiras. Whatever the treatment principles are explained for Pranavaha Chikitsa, you can adopt. Murti Dalgas. Chatush Prakar, Murti Dalgas can be adopted for that. So that will be the best treatment. Similarly, you need to go for Balavardhana Chikitsa. Balavardhana after, you can go with one Sniggdha Virechana followed by one Brahmana Vasti or Vyapana Vasti or Rasayana Vastis. There are Vedya Vastis that have been also come. Right? So you can adopt all those things, definitely patient will respond.
Can you throw light on Krishampramehi Chikitsa? Krishampramehi Chikitsa, especially after menopause, so women are more tend to get the diabetes after menopause. What I observed nowadays. So can you throw a light on this?
Sarvaiva prameha kapha. So almost all the diseases, almost all the prameha yogis starts with prameha, ends with the prameha yogi. The tail and kapha prakopa will be there, but without treating kapha dosha, you cannot treat vata yoga. So in Krisha pramehi also, the first line of treatment is Langhana and Ruksha. But the application of the severity of Langhana and Ruksha, what you have adopted in Sankalpa of the Chikitsa cannot be done. Because it is a terminal part of the avastha where water is more dominant. So the first line of treatment would be Sneha Yukta Virechana followed by Alpamatra Sneha. After Rukshana Karma, you have to go with Sneha Yukta Virechana, go with the Dharmandara Gata, go with the Darimari Gata. So these are the best bread of choices in Krisha Prameha. For Sneha Paramata. Because always remember, Agni will be enfeebled only when we if you describe Alpamatra Sneha, that is why Sasneha word has been used in the context of Pitta dosha. Pitta has got Sasneha. Sasneham iti Ishat Sneham iti Acha Sneham. So, Alpamatra Sneham Prayoga in Prameha Vyadi is very crucial because Prameha basically associated with Sankarpana Vyadi. You cannot give huge quantity of Sneha, like Avana Krama is complicated. That is why you go with Shamana Sneha format is the best line of treatment. I used to prescribe 2.5 ml, 1 ml, 1.5 ml of Sneha in a pressure program for a period of 3 days, 5 days, 7 days. We are not going to look into the Samyak Snigdha Lakshanas. We are going to observe the Agni Vruddhi Lakshanas, right? Shramahara Lakshanas, Dhatu Karpana Lakshanas. That has to be observed.
Sir, last question regarding the when to start with allopathic medications like metformin or Levit, right? So APS can be take around 300 APS. Can we treat it without metformin? Can we start allopathic medications without starting metformin? And where to start and where not to start?
The Vyadi Prameha has been explained in the classics so long ago, before the invention of metformin. Try to understand the Vyadi as Prameha only. Try to incorporate the Chikitsa as Prameha Chikitsa only. Then there need not be a question of starting with any sort of OHS by a Ayurvedic clinician, oral hypoglycemic agents. Right?
My dear delegates, you can ask all of your questions once after the session completes. Kindly excuse us. Over to Dr. Vinaykumar for the next talk.
It's very interesting debate. Right. Let's move on with the Pranavaha Sroto Vikaranam. I request Dr. Pramod Katti to begin with the presentation. The management of common respiratory diseases, again, clinicians of whatever the orthopedician, jnana from the Shastra you gain at the clinics, try to inculcate, incorporate and execute at the clinics. That is what is the only intention of these two presentations. Whatever the jnana you have got at the classroom, you should have that yukti, how to utilize this in the clinics over the patients. Right? Please, over to you, sir.
These are the references. You can go with Pranavaha Sroto. Management of common respiratory diseases. So Pranavaha Sroto is not only the respiratory disease, right? That has to be understood first. Teacher never teaches. The student learns. So what type of students we need? We need to have a student with inspired teachers. You all have inspired many of the teachers because you are asking continuously questions. Your inquisitiveness in asking the questions are never ending. So you are the teachers for us. Thank you for that. That is why we have got 6 different type of teachers. Adhyapakas, Upadhyayas, so Panditaha, Acharyaha, Drashtaha, Guru. So 6 different types of teachers are there with us. So one who transforms your life is Guru. So one who gives you the mukti is the Guru. So Drashtaha, who gives you the futuristic thinking. Acharya, who helps you to improve your skills in diagnosis, in treating, or in observing anything. Panditaha, who gives you the deep insight about the subject or the topic. Upadhyayaha, along with information and knowledge, and Adhyapakaha, who gives you the only information about the subject. So prana, one after Dasha prana Ayana, Oja Shukra Shonita and Mamsa are the sthana for the Pranavayu. And prana, the strength and stamina of the body. Prana avyogam acharyanam langanam acharyanam. So Vandana Chikitsa, Apatarpana Chikitsa should not be Prana Virodhi. It should be Prana Virodhi. That is why Bala is there in Anila. That is why Prana should not be disturbed by the Vandana Vikarana. What is Pranavaha Srotas? Pranavaha means wherever Pranavaha circulates in the body, the entire body is considered as the entire part of the body or entire body is considered as a Pranavaha Srotas. So Pranaha, Pranavatam, Yatrashadaha. So you know all these things, I am not going to all these things. So this gives you the implication of the Pranavaha Srotas is central nervous system. Further, Pranavaha Srotas is Rutparvanam Brahmo, Murcha, Darshanam, Tamasas tatha. So Pranavaha Srotas as Majjavaha Srotas. So Majjavaha Srotas can also be understood as a Pranavaha Srotas. So further, you will also get many recognises neurological diseases or muscular Majja. So comes under the group of Majja disease of the bone marrow. You do not get Pratishaya, Kasa, Shwasa in Pranavaha Srotas. In Pranavaha Sroto, Drushti Lakshana. So Shleshma, Agni Sadanam, Vasayagana Gauravam. So in Kapha Pramova, whenever Kapha is getting accumulated in Pranavaha Srotas, the person suffers from Shwasa, Kasa, Adhikrita, along with Shraddha, Kata. So, the doshas with respect to the srotasas. Pranavaha Srotas, Shirashi Indriyani, Indriya Pranavahani, Srotamchi, Suryaniva, Navastaya. Pranavaha Srotas, the sthana of Pranavaha Srotas is Hridaya Moolam Maha Srotasya. Similarly, the prana which is present in the Shira Pradesha, so Shira and Indriya can also be considered as a Pranavaha Srotas. So, the rate of respiration, 15 per minute. Pranavayu. Pranavaha Srotas is, you can identify Pranavaha Srotas in Sharira as a nervous system. You can also identify it as a respiratory system. You can also identify it as a functions of the Hridaya and Maha Srotas. Hridaya and Maha Srotas functions. Pranavaha Srotas as a GIT function. Pranavaha Srotas as a psycho, neuro, endocrinological function. So, in this presentation, we are going to discuss only with respect to respiratory system. We are not able to explain all the diseases. So, I have focused only on identifying and understanding Pranavaha Srotas with respect to respiratory disease. So, respiratory pathologies, different multi-types of things which you are getting. In Jwara, you are getting Prasashwasa. In Pandu, you are getting Shwasa. In Hridroga, you are getting metabolic disorders, you are getting CNS pathology, you are getting Shwasa Sambandhi Lakshanas. Pranavaha, which is involved. So, in infectious diseases or in inflammatory disorders or reinfectious conditions or multi-drug resistance conditions, you are getting Pranavaha Drushti Lakshanas, Pranavaha Sroto Vikaranam with respiratory diseases or altered immunity or suppressed immunity conditions, hypersensitivity disorders or you will also get in autoimmune disorders and Pranavaha Dosha, Viparita Chikitsa, then Vatanavana Chikitsa and Balavarthana with Sneha. So, in allergy, it was different. In infections, the line of treatment is different. Because here Ama is associated, then Ama was not there. When Ama is there, Pachana comes into picture. When Ama is not there, Pachana will not comes into picture. Sama Kapha, you can go with Shadharano. Simplest of the simplest Chikitsa is Katanasa Pradhana Chikitsas. These are the Shwasa Pradhara, Apapukara, Yadhyadi Kashaya, Indukantam Kashaya, and Pimpali Ramthana Kashaya can be prescribed to the severe extents. Samapita Avasthas, Vadachiragadi Kashayam, Drakshadi Kashayam, or you can go with the Drakshadi Kashayam is very, very important. Whenever Nirama Avastha is there, you prescribe Drakshadi Kashayam. If you do in Samapita Avastha, thinking that Pitta Shamana will happen, Samapita will increase. So, it's very important that we should not supposed to prescribe Drakshadi Kashayam in Samapitta Avasthas. So, Pushmanda Rasayana, Amrita Parasha Rasayana or Amrita Parasha Rasayana power. So, next one is viral infections. Clinical features of Amavishal can be seen in the respiratory disease. There will be a watery expectorant, Tanukaha, then running nose will be there, high grade fever will be there in cases of viral infections. What is the line of treatment? What is the line of treatment? I will just mention the name of the drugs over here. I have not mentioned the treatment principle. I expect you people to tell the treatment principle for this. What are treatment principle? Viral infection treatment principles. I have just shown you the drugs you can prescribe. Petumanam, Sudarshana, Indukantam, once Vishalakshana were reduced, Trialkyadikasharan, if patient has got pleural effusion. Right? You just tell me the answer for it. Recurrent infection, patient comes to your OPD, repeated bronchitis, repeated running nose. So recurrent infections, why recurrent infections happens? These are the reasons why recurrent infections are coming to our OPDs. Repeated over-the-counter products the patient consumed with multiple antibiotics or without taking the consultation of a Vaidya. Antihistamines or uncontrolled diabetes or anemia or recurrent usage of the antibiotics or immune deficiency disorders or any of the sexual transmitted diseases. Why recurrent infections are happening? From viral perspective, Sama doshas were treated with Pachana. Sama doshas are transformed to Pakva doshas. Once Pakva dosha is formed, patient does not care for the follow. And what will happen to the Pakva dosha in the Sharira? Where those Pakva doshas will go? Sushuta, Uttara Kuntra, 39th chapter. Name of the chapter is Sroto Chikitsa tatha. What he has told? Sroto Chikitsa, Vishama Jora. Or Pranavaha Jora. Pakko hi antarhrito dosho. Pakko hi antarhrito dosho. Pakko doshas, if they go and settle down inside the tissues, they are waiting for favorable conditions. So recurrent infections will happen when the Pakva doshas are not removed out of the bodies. It's very, very important that once you apply dosha viparita chikitsa, hetu viparita chikitsa, it is must and should that you apply dosha viparita chikitsa. If you do not apply dosha viparita chikitsa, then recurrent infections are the outcome of that. So it's a Vaidya Kata or sometimes patient may not come for the follow-up treatment. So, if the recurrent infections, chronic infections or chronic inflammations, immune compromised conditions, recurrent respiratory tract infection, recurrent urinary tract infections, recurrent manifestation of drug resistant tuberculosis, etc. All those conditions comes under the group of recurrent infections. So, improper diet or mismanagement of the weight. I have not prescribed appropriate medicine in appropriate avastha. Patient came to me with samavastha, I have not prescribed Pachana Chikitsa. So I have prescribed some Vyadi Viparita Chikitsa. So that's why mismanagement is also one of the cause for the recurrent infection. Sedentary lifestyle. Right. This is very important. If you do not treat Samadoshas correctly, if there is Sama Kapha, if you treat Vaidikata Aparadha, if I have not prescribed correctly, then what will happen? It gets organized inside the tissues or inside the systems. What will happen? New growths, new masses. Why cancer is more nowadays? Our technology has advanced, or we are able to identify cancer at very, very primitive stage. Is it so? No, most of the time we have made Ashuddha Chikitsa. Most of the time we have suppressed the Samadoshas. Most of the time we have suppressed the allergies or infections and inflammations. That is why it has entered inside the tissues. So tissues have lost its normal prakriti. Sharirika and Manasa prakriti cells have changed. So it has lost its regulation. The cell has transformed from self-regulation to auto-regulation mode. The cell has started a division in 15 days from 1 to 2, it has started 1 to 10. So, auto-regulation, the cell has a switch off, hence there will be unwanted and excessive growth. Samadhita, there will be excessive separation. I will ask you one question. If the infections are there in the upper respiratory tract, what is the line of treatment? One more question. If infection is there in the lower respiratory tract, what is the line of treatment? How to approach for lower tract infections and upper respiratory tract infection? When you are going to prescribe Rukshana, when you are going to prescribe Pachana. If it is Samavata, then there will be a fibrotic changes and fibrosis. So the tissues will become hardened, the elasticity is lost. So there will be a fibrotic changes. What is the line of treatment in Samavata? Once Samavata is removed, you go for the Snehapana. You go with one Vilechana, one Snehapana. The patient will respond very beautifully. So treatment, Abhidipana, Sroto Shodhana, then Brahmana, then with the help of recurrent Snehapana Krita, not Taila. So Brahmanatha, Chauraprasavaleha, Agastha Rasayana, Amrita Prasha Rasayana, Pushpanda Rasayana, Pippali Rasayana, Gadimadika for the Snehapana, then you can also give the Kantakara Hita for the Snehapana. Last one. If the respiratory disease is manifesting out of autoimmune condition, what would be the reason for that? The reason predisposing factors are Viruddha Ahara. So once a Viruddha Ahara or any of the suppressed inflammatory conditions or Garavisha, Alpamedia, Garavisha or the wrong treatment in wrong avastha. Then there will be a Ashuddha Rasa that leads to Ashuddha Ojas. Where Oja is present in the body? Inside the cell, no? Cell has got nucleus, nucleus has got the powerhouse of the cell, and this nucleus has got its protein material, DNA structure, then telomeres at the end. So the whole immunological complexes of a cell or entire body is regulated by the Oja. That is why once Oja is getting Ashuddha, then what will happen? The prakriti of the cell is lost. The oral cavity or buccal cavity has got epithelial cells. The epithelial cells have transformed itself because of the intervention factors of the Visha, squamous cells. Squamous cells are normal? They are abnormal. Squamous cell carcinoma. So the entire Sharira prakriti of the cell has changed, the entire Manasa prakriti of the cell has changed. So the cell have become auto-regulated, that is Manasa prakriti, that is entire prakriti of the cell has completely changed. That is why the line of treatment is Tatra Dhanvantariyanam Adhikaram. So autoimmunity becomes very difficult to manage asadhya. So infection spread by the antibiotics, suppressed by the antibiotics, or interstitial lung disease or lung fibrosis, all are because of the autoimmune complexes. So Viruddha Ahara has got two effects. Viruddha produces Vishama Dhatu. Vishama Dhatu will produce, along with Vishama Dhatu, there will be a, all Viruddha Ahara does Tridosha Drishti or Tridosha Prakopa. So Tridosha Prakopa will lead to accumulation in the Viruddha tissues, produces tissue-specific, organ-specific, system-specific, cell-specific autoimmune disorders. So you can explore autoimmunity to so much of extent. Pakkohi antargata dosho mahatya vishamamva jaram kuriya bala vyapana nemacha. So the diseases are born out of bala vyapana nemacha. So all autoimmune disorders can be understood to this particular context because we have suppressed samadoshas which are moved into the dhatus, producing different diseases out of those tissues. Stage 1, you can go with the treatment of Vikaranam Chikitsa, Vikaranam Chikitsa, or Tikta Rasa can be given in the form of Vikaranam because Tikta Rasa is the stage for the Vikaranam. Deepana, then you can go with the Sharanga Paniya. Nitya Sevana Jala can be processed to Sharanga Jala, or Amrita Sharanga, or Guruchi Kashaya, or Patoladi Kashaya can be processed in 3 liters and kept in the form of Siddha Jala, not Kashaya, Siddha Jala. Ask the patient to continue the same. Stage 2, once Nirama Avastha attained, then you can go with Bala Vardhana Chikitsa. In Bala Vardhana, you have to go for repeated usage of Sneha Prayoga. Repeated usage of Sneha Prayoga in the form of Tiktaram, Mahatiktaram. If you want to go for Dhatu Tarpana, you can go selection of the Dadi which has got Madhura Rasa. It should be given in a very short time, very less quantity because the underlying cause is Viruddha and Visha. So Panchagovyam, Mahatiktaram, Kalyanam, Athav. Tyaga, Vishama Setuna, Vishama Hetuna. You have to advise the patient to go for all the ecological factors should be made clear. So Samavada teaches Langana Dihana, Samakapa, you can go with the Langana along with Pachana. If it is Dikta and Katavasas are most prescribed in the context of attainability, then Virama Avastha, you can go with the Sneha Priyavasa. Nayopayam, one of the best drug of choice in Shasaroga, having attainability, you can go with the Deepana and the Balkan. Brahat Nayopayam, where you can give it to the PAH, or you can also give it in a condition where cardiac output is reduced, or cardiac output is reduced, resulting into breathing difficulties, exertional dyspnea. So, our cardiac output has reduced. In such condition, you can go with the Brahat Nayopayam. Vidavyadi Kasayam. So, in Nirama-avastha, you have to go with the Vidavyadi Kasayam, which corrects the cardiac rhythm or respiratory cycle. And Balya Brahmanartha, this was a common combination which I do in my practices. Shalapati or Sahasrapati or Bhavakavasma, with Megashinga Vasma, now it is not available. So you can go with some other Vasmas, or only Shalapati or Sahasrapati or Bhavakavasma, Amrita Sattva, Yashara Vasma, and you can mix with the Lagu Sutta Mishra. Thank you.
Before going to the questions, I request Dr. Mahesh Salimath sir to throw some light on the role of Swastha in Pranavaha Sroto Vikaranam.
So Pranavaha Srotos as the prana, as the life is. Pranayama is one of the biggest, it has biggest role in maintaining Pranavaha Sroto Vikaranam. Pranayama. The meaning of pranayama itself here is how to control the prana or how to maintain the prana in our body. Ayama, that is structuring it in a very well manner. Or stretching, the number of stretching here, we are reducing the number of counts of breathing per minute. That means there are ashtakumakas which all of you know, you know that very well. So it depends, the things which you should remember here is how good we practice pranayama in a proper way and proper things. Controlling of prana is like controlling an elephant or a tiger or a lion and train it. If you do not control it in a proper way, then it may destroy our whole health. That's why control it in a very systematic way. If you, for example, there are ashtakumakas, Surya Vedic pranayama should not be practiced in summer seasons. Chandra Vedic pranayama should not be practiced in winter seasons. With the same Shitli pranayama and Sikkari pranayama cannot be practiced in the winter seasons, as already the food in the body we cannot practice it in this way. We have to look after the patient in a very systematic way. After looking at the condition, Rogabala and Rogibala of the patient, one has to decide which type of pranayama is to be prescribed and the count is to be properly prescribed to the patients. This is one. Exercising the breathing exercise are very important things which will help us. Any things which are going to help in increasing the immunity and immune power of individual. All things can be practiced in yoga or in padya or in exercise or in any Swastha activities like it may be dincharya or it may be the Kalpachara or it may be Dincharya which can be practiced here. Moreover, Pranavaha Srotos is all about prana. That means whatever the vital things are there, you just concentrate on that. If any questions, just try on to answer them. As because time is running out.
यावत् वायुः स्थितो देहे तावत् जीवनम् उच्यते मरणं तस्य निष्क्रान्तिस्ततो वायुः निरोधये. Any queries? Any queries?
Namaste. This is in relation to the first session. Can you please let us know the role of ragi and wheat in diabetics of diabetes? Because there is so much of bias opinion.
Again, repeat it.
So these are very important things which should be consumed because calcium is a need and even the meat is need. Whereas jowar has more sugar than this wheat. That's why it's better to go with wheat rather than protein.
Any other questions? Yes, please.
So my question I would like to explain to you that as you mentioned, we have to give treatment according to avasthas of the vyadhi, and if we fail in that, so we only create the next avastha of the vyadhi. But what if the patient is having the same and it has developed or progressed with the next avasthas, and he has taken allopathic medicine and afterwards has gone to Ayurveda treatment. So is it compulsory that we should consider it as Vikaranam Chikitsa and how we take into it?
Based on the chronicity of the disease, when the patient enters into your clinics, it is your responsibility to assess the avastha of the vyadhi. You will be the in charge, right? Whether the patient had been to allopathic chikitsa, it's all doesn't matter. That time when the patient enters into your clinic, it is your responsibility to assess the avastha of the vyadhi. Based on that avastha, if you incorporate Chikitsa Sutra, then it will be successful one.
Yes, sir. Sir, as sir mentioned, it is the avastika chikitsa they have to make, and the patient has accustomed that to avastika and developed the next avasthas. So along with that, they have taken allopathic medicine. So is it necessary to consider it as a Ganavisha and along with the avastha? The same avasthas they have to repeat the chikitsa or the current avastha they have to do the chikitsa.
Pranavata is a circulating kapasthana. First itself is a Vidyasa Chikitsa. So Vidyasa Chikitsa starts from itself. The sthana of pranavayu is in kapasthana, Sambhasha. Right? So that is why there is always possibility, most of the time, Pranavata is getting avata by the population. Most of the times. Sometimes dosha is associated with Galavisha. Sometimes doshas are associated with the medicines which we prescribe in the form of antihistamines or antibiotics, or sometimes we give immune suppressants. So whenever we give all these things, definitely the metabolic toxins will be suppressed inside the body. You have to remove the visha from the body. That is the line of treatment. Either you have to metabolize or you have to neutralize. There are only two options for treatment for visha. You have to neutralize it, you have to metabolize it. As visha cannot be metabolized, you have to make it neutralized. So, which visha can be made metabolized? Ama can be made metabolized. Ama visha cannot be made metabolized. Two avasthas are there. In the Amavata, Tikta Deepanani Katunicha. He has not used any word Pachana and Chikitsa Sutra of Amavata. There we are prescribing Katurasa, Tiktarasa for Agni Deepana. Why? Because there is no Ama. There is Ama Visha is there in Amavata. So the first line of treatment in Amavata is Langhana and Deepana, not Pachana. In Jwara, Langhana followed by Pachana. There is Ama. In Jwara there is Ama. In Amavata there is Ama Visha. You go to another avastha in Sharya, Vidradi, Ama, Pachamana, Pakva avastha. In Ama avastha of Vidradi, what is the line of treatment? Pachana is not there. Langhana is there, followed by Rukshana. Langhana, Pachana in Jwara, Langhana, Deepana in Amavata, Langhana and Rukshana in Vidradi. All the three conditions Ama is there, but the combination of treatment principle changes. This is the beauty of acharyas. They are very in-depth understanding, they are very focused. They are very truly scientific judgments. So it is very, very important that each and every moment when you encounter patient, you have to assess the avastha of the patient. If you do not identify the avastha of the dosha in each and every sitting, it is not possible to treat the patient. That is why whatever the treatment you give, dosha viparita chikitsa, hetu viparita or vyadhi viparita in any context, second time when patient comes to your OPD, you have to reassess. Disease may be the same, avastha will change. That is why Viktasa Chikitsa holds good in Pranavaha Srotas. Because you cannot give continuously Kapara Chikitsa. If you give Kapara Chikitsa, Vata Pranavaha takes place, Vata Shamana is required. If you give more Vata Shamana, Kapha aggravates. So there will be Avana by the Kapha. So you have to identify Kapha Pranavaha. Context is Kapha Vata. Kapha Vata means what? Kapha Pranavaha or Udana or Samadha or Vyana. So you have to locate where Avana is happening. The extent of lesion, the nature of lesion, you have to identify in the avana. Extension of lesion means kaphavata prana is there from shiras to kantha. So your line of treatment focuses on here. Kaphavata prana vayu in Uttarapradesh, the line of treatment focuses on the respiratory system. So the clinical application changes. Kaphavata vyana vayu, one side it is a general statement. Kaphavata vyana vayu happening supti in husband and father, the line of treatment for husband and father, kaphavata vata chikitsa has to be followed. So sarvanga vata lakshanas, kaphavata vata. So general statement may not applicable to the vishesha avasthas. So each and every context you have to identify the avasthas. So that is why in hetu viparita chikitsa, amahara chikitsa or vishara chikitsa. So the patient is depending on allopathic drugs, you can give. You can stop them, you can transfer patient if possible, you give it the Ayurvedic treatment, then you make a utilization of the adversities of the allopathic drugs, then minimize it, then shift to Ayurvedic treatment. So if you could not able to completely stop allopathic drugs, at least minimize the medicines.
Any more questions? On behalf of both the speakers, Dr. Pramod Katti sir, Mahesh Salimath sir and myself, Dr. Hiremath, we thank the organizing team, Dr. Sroto Vikaranam sir and the whole team of the TSP2025 Parishad Season 5 for giving us this opportunity to place this class and to sit in front of you. And thanks to the knowledgeable audience keeping so much of patience to listen us. Thank you and all. Thank you so much.
We are grateful to listen to you, Dr. Vinaykumar sir. Thanks to you. And Dr. Pramod Katti sir, thank you. And Dr. Mahesh Salimath sir, thank you so much. So now I request Dr. Sambhasha sir, founder, organizing secretary, tadvidyasambhasha parishad, to felicitate all the three legendary gurus. Firstly, I request Dr. Vinaykumar sir, being a moderator, to kindly receive the felicitation. Ajit Desai sir, Associate Professor, Department of Sambhasha Data, Ayurveda Mahavidyalaya Hospital, Hubli. Dr. Ranjit sir, Assistant Professor from the Department of Shalya Ayurveda Mahavidyalaya Hospital, Hubli, to kindly receive the felicitation and vote of respect.
तीनों वक्ता को तदविद्यासंभाषा परिषद के तरफ से बहुत बहुत धन्यवाद हम समर्पित करते हैं। और मैं चाहता हूं कि धर्माधिकारी सर और त्रिलोक गोपेश्वर सर मंच पे आए और बृहद्रयी संहिता विषय मंडल के जो भागीदार थे उनको प्रशस्ति पुरस्कार देने की 10 मिनट की कार्यक्रम है। और मैं चाहता हूँ कि ऑडियंस जितने हैं उनमें से कम 2 ऑडियंस मंच पे आके अपना मंतव्य बताएं तद्विद्यासंभाषा परिषद के। आपको कैसा ये महसूस हुआ और आप क्या आगे के कॉन्फ्रेंस में हमसे चाहते हैं वो हम सुनना चाहते हैं ताकि हम अपने बुराई को करेक्शन करने में सफल हो सकें। आई रिक्वेस्ट Dr. Dharmadhikari sir to come over the dais